So I'm Zarnie. I'm a senior lecturer in health promotion at the University of East Anglia, which is at somewhere called Norfolk, which is a 2-hour train ride from London. Prior to that post, I only started this current position in April. Prior to that, I was working at the Centre for Implementation Science at King's College London, and the director of that centre is Professor Nick Sevdalis, who many of you I think might know. So I'm going to be talking about how to succeed in the implementation of an e-health intervention. So with the aim that some of the methods I'll be talking about are relevant to antibiotic stewardship and infection control. So just to give you a brief background, professional background, not personal background. Over the past 12 years, my research has focused on the use of digital interventions for reducing alcohol consumption. So alcohol is one of the leading causes of preventable death worldwide. And we have around 3 decades worth of research showing that brief interventions are effective at reducing alcohol consumption. So basic screening on alcohol with a very brief conversation about why it might be a good idea to change. However, only around 3% of people are actually screened for alcohol in primary care. That's across Europe. So despite international policy recommendations, there's clearly a problem with implementation there. So I was one of those people that thought, we'll fix it with an app. Rather naively, and since then we've also realised that you also have to implement the app. So I now have been working with the Centre for Implementation Science to try and work out some of the methods in which we can implement these interventions. So I'll just start with a very brief definition of what I mean by e-health. So this is quite a broad definition. There are lots of definitions out there. So it would encompass management systems, so electronic medical records, communication systems, so this might be via Skype, so synchronous or asynchronous communication. Also decision support systems, including computerized clinical decision support, and then also information systems, and so behaviour change interventions, apps or websites would also come under this category. So I'm going to structure this presentation around something called the Impress tool. So this was a tool that was developed by researchers at the Centre for Implementation Science. It's freely available from the website there, and it basically provides you with 10 core components of the things that you should consider when conducting implementation research. And these were determined by a review of the literature, by various different consensus meetings, and by consulting experts in the particular fields. So I won't run through all 10 of these, but I'll talk about some of them in a bit more detail. So starting, of course, with the determinants of implementation, which we now know is the sort of essential starting point, although actually you did have one stage prior to this, but I'll be starting at this point. So in talking about the determinants of implementation, I'm going to very briefly introduce you to one framework, which we'll then talk about in much more detail in the next session. So selecting and developing an overall implementation strategy is very much dependent on the context of a given implementation effort and the systematic identification of implementation determinants, so for example, barriers and facilitators. So this is known as the Consolidated Framework for Implementation Research. It's one of the most popular frameworks out there that are used for identifying determinants of implementation. It's known as a meta-theoretical framework in that it was formed by a large review of existing frameworks and incorporating them into this one meta framework. So very briefly, very, very briefly, it consists of 5 domains, which are the intervention characteristics, the inner setting, the outer setting, and the individuals involved in the process. And then under each of these 5 domains, there's further constructs with more information. So just to see how you might apply this to a particular example, so as I mentioned, alcohol brief intervention is my background. So, and this is an example of the determinants, some of the reasons why there are so many barriers in primary care to delivering alcohol screening. So for the outer setting, which is where it says NHS employers, these are the people that determine the financial incentives for things like screening, and up until recently there weren't any. There are now some for particular groups of people. So for example, people with bipolar disorder, there is an incentive to screen for alcohol consumption, but there's no universal financial incentive there. So that's a potential barrier and facilitator at that level. Then at the inner setting level, so if we're assuming this is primary care, we could say that they're very much driven by whether or not there is a financial incentive involved, and so that will determine whether or not alcohol screening is adopted. Then we have the individuals involved, so this is a combination of patients and practitioners. So one of the main barriers to delivering alcohol screening is the perceived impact on the patient-provider relationship. So that's also something that is another barrier. And then so in terms of an intervention, so you might be delivering a website to support people in reducing their drinking. And so the original website might be one that's just standalone and designed for the GP to refer patients onto. However, GPs might feel uncomfortable doing this, and so they've now been adapted, or more recently there's been more of a focus to facilitate access to the intervention. So the GP will introduce the digital intervention to the patient. They may go through some of the sections, and then they might be encouraged to return to talk through the intervention. So, and we actually know that there's evidence that that approach is more effective at reducing drinking than standalone. Then finally, for example, in terms of process, one potential facilitator of the implementation process is having a champion to encourage people to implement the evidence-based intervention. So the barriers and facilitators to implementing e-health, there's been a lot of research in this field. There's been 2 systematic reviews of systematic reviews. So the Ross review is basically an update of the Mayor review. These are interesting because they both used implementation theories and frameworks to organise the synthesis of the findings in their reviews. And the more recent review of reviews used the CIFA to organise data in their review. So I'm just going to talk you through some of the findings that the Ross review found. So they found studies that looked at electronic medical records and clinical decision support systems. These studies had focused on primary care, secondary care, and home care. And they found that there were important factors, as you might imagine, at all levels. So from outer setting all the way through to individual and intervention setting. And then this is just a snapshot from their paper. So they actually, once they'd collated all this information on the barriers, they came up with various different recommendations for implementing e-health interventions. So they mentioned that complexity, adaptability, compatibility with existing systems and work practices, and cost were all important in the selection of an appropriate e-health system. It's important to involve key stakeholders and implementation champions as early as you can in the implementation process, that you need sufficient financial and legislative support, that standards for technology which address interoperability and security are important, planning implementation again is important, as is the provision of training and education, and that it's important not just to stop thinking about the implementation process from the point at which you go live. So there's lots of information there, lots of potential, what we call implementation strategies. So now I'm going to talk a bit more about implementation strategies. So these are considered to be methods or techniques used to enhance the adoption, implementation, and sustainability of a clinical program, practice, or intervention. And we've already seen a list of behaviour change methods which are also considered to be implementation strategies. Another team in the US have identified what they call I don't know if they call it a taxonomy, but basically a taxonomy of 73 discrete implementation strategies. That's not to say that's an exhaustive list, but they put a lot of work into that. And so those have then been grouped into these 9 sort of categories of what the main implementation strategies are considered to be. So these are things like using evaluative and iterative strategies. So for an example would be audit and feedback. To provide interactive assistance. So an example would be facilitated access to a digital intervention. To adapt and tailor to context. To develop stakeholder interrelationships. To train and educate stakeholders. Support clinicians, engage with patients and service users, to utilise financial strategies and change infrastructure. So again, this has previously been mentioned as a really helpful resource. So again, this is the Cochrane Effective Practice and Organisation of Care Group. And I'm pretty sure that actually it was Jeremy Grimshaw that conducted most of these reviews. These are potentially effective implementation strategies. But again, I don't have that lovely one-size-fits-all slide, which I wish I did. But just to consider they may or may not be effective in your particular context for your particular intervention. So these are some of the implementation strategies that have been used in the UK to implement e-health technologies. So we have what are called global digital exemplars. So these can be acute hospital trusts or ambulance trusts, mental health trusts that have been identified as internationally world leading in terms of the care that they provide through digital technology. And the idea is that they'll share their learning and experiences to enable other trusts to follow in their footsteps. So it can be scaled up a lot more quickly. We also have local digital roadmaps, which are basically plans for operationalising the digital ambitions set out in what are called local sustainability and transformation plans, which are basically based on local priorities. We have in mental health settings, so we have a service called the Improving Access to Psychological Therapies that provides a stepped care approach to mental health care. And the first step in that stepped care approach is receipt of computerized cognitive behavioral therapy. So it's routinely delivered as part of that care pathway. We have an NHS apps library, which has recently been revamped because they're putting quite a lot of time and effort into thinking about how do we go about selecting apps for the library, what are the criteria, whether it's evidence-based or usability, security, all those sorts of things. So the library is actually quite empty because it's taking them quite a long time to decide. It's a complicated process. As I mentioned before, facilitated access to digital interventions is another potential implementation strategy, as is the innovation technology tariff, which is basically a financial incentive. So these are some of what have been considered as some of the guiding principles to going about selecting your implementation strategies. So obviously context is an important place to start, so selecting discrete implementation strategies to address contextual needs, so looking at your barriers and facilitators and how best to match strategies to address those. There's also a need for the use of systematic methods for selecting and tailoring implementation strategies. I don't have time to go into these, but there's methods such as concept mapping and conjoint analysis, and if anybody is interested, there's various literature that I can point you in the direction of. It's important to consider whether or not your implementation strategy does have an evidence base. It may or may not be relevant to your context, but it's still an important starting point. There's also a recommendation that you consider the importance versus the feasibility of each of the implementation strategies. So what's most feasible? Do you have the resource to offer financial incentives? That sort of thing. There's also some evidence to suggest that there's no optimal number of implementation strategies. So essentially, the more you use, the better. And then finally, it's important to think about how you're going to measure implementation. So I'll talk a bit about that now. So in terms of measuring implementation outcomes, so these are seen as being distinct from service outcomes, so where these are things like efficiency and safety, whereas patient outcomes are obviously function and symptoms. And there's a researcher who has come up with what she calls a working taxonomy of implementation outcomes. So I'm not going to run through all the definitions, but the outcomes are acceptability, adoption, appropriateness, feasibility, fidelity, implementation costs, coverage, and sustainability. Now, obviously, these aren't all the implementation outcomes out there, but one of the nice things is that they do apply across all healthcare professionals and across all the different levels. So, for example, outer setting through to individual behaviour. Okay, so in terms of selecting an implementation outcome measure, it's important to think about the level of analysis. So who are you focusing on? So you're looking at the individual patient, the individual provider, or are you interested at looking at things from an organisational level? It's important to think about the salience of the implementation stage. So obviously for sustainability, we're interested in later on in the implementation process. For adoption, early to mid, and then obviously acceptability is relevant throughout. And there's no right or wrong way of measuring implementation. So ideally, you would use a combination of both quantitative and qualitative methods. So, for example, observation through to survey data and routinely collected data. And then your choice will obviously depend on what's feasible to you, what research expertise do you have. So my postdoc project when I worked for the Centre for Implementation Science was all around the quantitative measures of implementation, so specifically surveys. So I embarked on a massive systematic review of implementation outcome measures. I still haven't finished it yet, but I'm getting there. So this was to identify, critically appraise and determine the quality and usability of studies, just those studies that look at the measurement properties of these implementation outcome instruments. There's already been a systematic review in mental health settings, so this is why we focused on what we call physical health care settings. So these were some of the outcomes that outcome instruments that I identified specifically for eHealth. So these were measuring things like perceptions of computerized therapy questionnaire, acceptability of computerized self-assessment, adoption of information technology innovation, information technology appropriateness survey, and the technology acceptance model questionnaire. So there's also lots of generic implementation outcome measures that may be relevant for use. I identified 2 in the infection field. So one was on attitudes to antibiotic policies. So this was a 12-question survey focusing specifically on pharmacists and physicians, conducted in Australia in a hospital setting, and looked at the following measurement properties. I also identified an instrument that was looking at HIV vaccine attitude scale with 20 items focused on consumers in the USA in community settings. So I know these are both quite fairly specific, but it's always a good starting place if you are going to use a survey or a questionnaire to see what's already out there rather than starting from scratch. So right, I'm just going to leave you with a couple of resources that you might find helpful. So this is specifically around implementation science approaches for integrating e-health research. And this paper provides lots of different research methods, particularly as digital health is a very rapid pace of change. And so often by the time we finished our research, the technology is obsolete. So there's some nice ideas for another one of the barriers for much more agile designs in this paper. This is some helpful reporting guidelines. So if you're ever publishing any work around implementation strategies, there's some nice recommendations for the sort of level of detail that it's important to go into and the things to consider. And then this is more general reporting guidelines for implementation research that were published, I think, last year in the BMJ, called the STARI guidelines. Okay, thank you.
On time, actually, so that's very good. So we have time for 1 or 2 questions. I will ask the first one. My request for implementation scientists in the room would be to write implementation science for dummies, book, because we don't have time to read all that. And it's really, really complicated. And I think that's very good for research, because that's lovely. But for practice, we would need really a short dummies book. That would be lovely. The things that really work in practice. I presume everybody agrees. Okay, so do you have one question? No? No question? Okay. Gabriel, please. Wait for the mic so we can hear you.
So what we can see clearly in your presentation, so the methods are pretty complex, you can say that, but at the same time it's pretty logic. Mm-hmm. We can definitely see that everybody can apply that on the field, but it is really the case. I mean, we are whole infection control physicians or nurses or antibiotic stewardship people. Can we do that by ourselves, or do we need, help from specialized people like you, psychologists, in our hospital with special position doing that, dedicated to this task? Don't know if the question is clear, but
yeah. So go ahead, and then Marlies will give her feedback on that.
So I've previously led a workshop fairly similar, but without the focus on e-health with Nick, and it was for our local council and their child protection agency, so not healthcare at all. And what they found helpful was sort of like a one-day workshop, what's potentially quite similar to what we're having here, with basic introduction to the approach, and then more hands-on interactive exercise in the afternoon. And then they were then able to go away and plan. We're not talking about like publishable research studies, but maybe more like service evaluation type study. And then they did actually come back to Nick and I for some feedback, but what we found was that there was enough in that one-day session to then give them a great starting point, and they felt then comfortable with a bit of added support to go away and just frame that evaluation slightly differently than they might do. Not huge, great changes in methodology, but using, for example, one of the frameworks and some of the outcomes and knowing where to look for the strategies. So,
Marlies, do you have the mic? Oh, okay. What about you?
Yeah, I am glad already if people in daily practice or in projects already apply the systematic approach. So if you go through the steps, that is already a huge improvement as to where we all come from. And yes, it's important to tailor, but there's also EPOC, so the Cochrane group. They also have written a review on tailoring. And yes, they can show that this tailoring principle works, but there are still many questions on how best to tailor. We don't know yet. But basically, I think there's two ways to do it. You can do it pragmatically, and do it systematically. And the overview that I showed from Vlottorp, that also includes the CIFER framework, so that's also included in the 12 overviews. But they have not only published this overview, but they have only published some checklists that help you in a pragmatic way to go through the various steps. So that can be very helpful already. But of course, I also urge, for example, stewardship teams, if they can join up with implementation scientists or psychologists, yes, they can do way more beautiful research than they do now. So that's a choice. Yes, you can do it pragmatically, and you can do it theoretically in the most perfect way.
Yeah, my personal feeling is that we miss people not interested into research, because what we are doing in daily practice is daily practice, not research. Yeah. And we want these implementation scientists to mettre les mains dans le cambouis, we say in French, so the really hands-on approach. Yeah. So we want them to work with us to see our problems, because you know we face pretty complex situations, and I think we are not there yet. You are working in a university hospital. I don't know if you do. So you see the problems every day, and we need that kind of approach, I think, because research is for researchers, but what we want is really daily practice.
And then a pragmatic but systematic approach.
We don't want to read 100 papers, because that's research. We want to read one short handbook and to be able to call you if we have a problem.
I hated to do all this commercial, but we write this book on implementation with Jeremy Grimshaw, etc. Okay. So there's this. We write a Dutch version and an English version. So every few years there's an update. But still, that's a book like this. And in Dutch we have once written it doesn't sound very nice, but it's implementation for dummies. Yeah, and that's in Dutch. And
write it in English.
Yeah, that would be an idea.
So,
okay.
Actually, the Impress guide that I talked about, that is specifically for researchers, but we work with I don't know how best to describe it, but they're not researchers, so they're not healthcare professionals, so potentially managers that are doing evaluations of research, so service evaluation as opposed to research, and they've adapted the Impress guide to suit them so that it's less academic and more user-friendly. And I think that's freely available over the internet. So I can
add the link, that would be lovely. Gabriella, I presume that the slides will be shared with everybody if the speakers agree? It's recorded. Okay, so everybody will have everything. Okay, thanks a lot. Thank you.